Hi guys, can you see my screen now?
Yes, sir, we can see the objectives.
So I think it was that same old simple problem, age old. You just switch off and switch on, things starts working. So,
Yes, sir, it's
so I didn't do
now
anything
sheath
technical.
tumor of.
The only technical thing that I did was to switch off everything and then restart. Okay, so I think you can start.
Greeting everyone. I am Dr. Divendra from Conceptual Orthopedic, and I welcome you all in today's connect session with Vivek sir. And today sir is going to discuss another interesting uh, uh, case of an sheath tumor of a foot. So I think this talk is going to be very useful to all of you. So without any more delay, I welcome you sir on the board, and I request you to start your presentation. Now it's over to you, Dr. Vivek sir.
Thank you, thank you. So friends, we are meeting after a long time. I think it's been a break. And I was also occupied. I know slowly as we become busy and busy in our clinical practice, taking out time for teaching is really tough unless you are really determined. So I'm glad that at least I get some time to interact with you all. And since I also run this fellowship program, uh, the teaching is not just theoretical, but it keeps happening on practical notes also. So today I'm going to talk about interesting topic, that is the nerve sheath tumor of foot. And recently, in last 1 month, in fact, I chose this topic because in last 1 month I operated 3 such cases, and I thought that it is worth sharing. So how many people they are there? So you can see good number, 17. Yeah, people are coming still. And if I see the name, yes, I can see Neha is there, Ashish, Tamapnam, Abhipray. So lot many people are now. Good. So majority today, I think even conceptual surgery residents are also interested to join, because this is something which often comes in the soft tissue aspect as well. So we'll keep this interactive, and I always advise you guys that you should keep asking questions if you have in between, and try to make it more interactive so that I also don't sleep in between my courses. I know you all sleep. I can't see you during that, but at least I don't sleep. So I have two choices only. One, you keep waking me up with your questions. And second, I have my cup of tea. So, yeah. So today we are going to learn in short a bit about the anatomy of the foot, where we'll just broadly see how, my topics are not related to just theoretical aspects about reading origin, insertion of muscles, or how you go, but it is more about all the practical approaches. When you are there, you have a patient of your own, and the patient comes to you and presents you with a problem, how you approach that. It's good to know all the theories, but I think understanding the practical aspects are also equally important. So if the patient uh, presents to you with pain in the foot, especially on weight bearing, how you evaluate, how you go ahead. So I will try to cover up all this in today's lecture. Second, when we look at the foot, how do we approach such lesions? What is the diagnosis? Which investigation? So how do you go about that? And I have kept some videos from the cases which I have operated so that it gives you an idea how we go about it. So see, usually, can anybody tell me? Yes, guys. How many bones are there in the foot? Somebody has messaged. 26. Okay. Any other? Any other guesses? Okay. ठीक है, good. So, once basically the topic is about nerve sheath tumor. Actually, later on, I felt because my patients were from with the nerve sheath tumors, otherwise the topic should have been soft tissue tumors of them, right? That is more applicable. It is not so that it is not very much focused only on one etiology, but usually when you have a nerve sheath tumor. So normally, how many arches are there in the foot? Arches of the foot? Can you name those arches? Yes, guys, come on, be interactive. Anyone? Come on, this is basic. I'm not asking anything advanced. Okay, Neha. Yahya. Okay. Yahya, you agree with what Neha is saying? Three arches, medial arch, one lateral longitudinal arch, and one transverse arch. Okay, good. So you see, basically, when we talk, let me draw this. So when we look at the foot from top, it is very much, everything is well appreciated because you can see that from the top, the bones are quite obvious, being especially it is subcutaneous. You don't have many muscles on top, but it's rather all the tendons of the foot. So you can easily identify the landmarks, like you see the tibia ends, your talus, then your calcaneum. Just assume that these are the foot. And then gradually your cuneiform, your cuboid, and similarly it after your tarsals, then comes your metatarsals and the phalanges. Like that, you go about it. But once it comes to the plantar aspect, so it is so thickened and well because entire body weight falls on our these arches when we wear weight when we bear weight on our heels. So the nature has given some tremendous amount of anatomy to the foot to bear all this weight. For spring action, we need to jump, we need to sit. So it has multiple layers. Can anybody just tell me how many layers are there in the foot? How many layers of muscles are there in the foot? I don't need all the muscles name and all, but I just want to know. 4, 3, 5. Okay, so we have many options here. 4 layers, 5 layers. Okay. Normally we say there are 4 layers. So, so when we have a lesion or when we have a problem in the foot, we need to identify where it is exactly situated. Can you tell me one of the most common condition when the foot is painful, especially when we see in middle-aged ladies, pain, especially in the morning, especially on the weight bearing? What is the condition called? Very good. So that's the plantar fasciitis. So today we are not going to talk about plantar fasciitis, but rather we are going to talk about the conditions, the soft tissue tumors in the foot, which may cause painful symptoms in the foot area. So now, can somebody elaborate differential diagnosis of, let's